Dr. Devi Nalapu. So, the floor is yours, Professor Subindu and Dr. Devi. So, you may call upon the presenters.
Good afternoon, everyone. My name is Dr. Devi. I'm from School of Nursing and Applied Science, Lincoln University College. So, a gentle reminder to all the presenters. So, kindly present your slides for 5 minutes, and the remaining 5 minutes we are open for the questions, mainly from the floor. So, you are allowed to, your total minutes for the presentation slot will be 10 minutes. So we would like to welcome the first presenter, Mr. Awad Mohammed. Are you here, Mr. Awad? Next, okay, we go for the next presenter, Yan Yan. Miss Yan Yan. Oh, okay, Mr. Yan Yan. Yes. So Mr. Yan Yan, today we would like to present about clinical intervention strategies for depression and anxiety in mothers of children with autism spectrum disorder.
Kirim yuk. Iya sama lah. Makanya pada sekali kalau akan Dulu ya.
Sukses ya.
Jangan sampai kalian bertanya ancam tadi. Sempat kalian bertanya tengok tak? Bilang lagi. Oh iya, ada slide yang itu kemarin. Apa pokoknya yang terakhirnya itu? Azab bertanya. Baginya itu tidak baginya bertanya. Jadi orang tak bertanya lagi.
Oh, aku slide pertama dulu.
Slide terakhir gue ya.
Ci gara-gara itu ditanya orang Cina tuh itu maksudnya.
I can say something. First of all, I welcome all of you to this session. The focal theme of this international conference, I must say that it is very timely concept. As a researcher of environmental science, initially I thought that how does this focal theme healthcare system relates to the environment and development. However, I find that at least the object of the sustainable healthcare system is the object of sustainable environmental development are related to a common objective of human development. Both are directly related to each other. In order to achieve the goal of healthcare system, sustainability of environmental development should come into play. Just at this context, we need to understand the healthcare system first. According to WHO, a sustainable healthcare system is a system that improves, maintains, and restores health while minimizing negative impact on the environment and leveraging opportunities to restore and improve it to the benefit of the health and well-being of current and future generations. But this is not possible without considering the measure of sustainability of environment in general and understanding the players of environment rather ecosystem where one considers the mode of sustainability in a respective ecosystem particular. For example, if we find that an area is negatively affected by an inferior and bad quality of various environmental factors, human society therein suffers. Okay, I think that the research to the significant conclusion by tolerance and concerned policymaker will help for this seminar. Thank you. You start.
Good afternoon, everyone. The title of my research is Clinical Intervention, Treatment for Depression and Anxiety in Multiple Children without Blood in Platform. Next, I will give my research. First, the introduction. This presentation of intervention for improving mental health in multiple children out of downside control of ASD. ASD affects approximately 1 in 100 children for parasites in developed regions. Multiple children ASD has significant psychological orders, ranging levels reaching 40% and anxiety at 50%. You can see in the data of the people, which is include North America, Europe, Asia, and Africa. And then objectives include first assessing the prevalence of mental health in multiple children ASD. Second, evaluating the effectiveness of CBTs, connective behavioral therapy, MBSR, and peer support interventions. Third, exploring the relationship between emotional mental health and child developmental times. Then, significance of the study. First, addresses gaps in caregiver-focused interventions. Second, highlights emotional mental health improves caregiving and child development. Next, research methodology. We use the mixed method then following 150 tests, sometimes into CBT and ESR, or peer support groups. This study consisted of implementation assessments, 12-week intervention period, and post-intervention evaluation, 3 phases, and comparison of interventions. Also, CBT focuses on changing negative thought patterns, and MBSR emphasizes emotional regulations through mindfulness. Peer support provides community-based emotional and practical recommendation. And we take the people. Then the data collection analysis. Key finding includes significant reductions in depression for 36% for CBT, 38% for MBSR, and 32% for 35% for MBSR. This level also includes across all groups, MBSR achieving the highest impact. The results, depression improvement, CBT and MBSR show largely reductions, which is 36% and 38%. The anxiety improvement, MBSR demonstrates significant anxiety reduction of 35%, compared to goals show distinct effectiveness levels. Then significant reductions in perceived districts, taking CBT and MBSR for powerful power support. Factor analysis is that key factors identified. Emotional well-being and cognitive losses. Study integrates cognitive behavioral theory, stress and coping theory, and social support theory to get intervention design and implementation. That theory provides roadmap to work for caregiver-focused support. Then, conclusion for CBT and MBSR are highly effective. The second, peer support includes social connections. Third, integrated care models are needed. There are some limitations and future direction. Future research should focus on first, impacting sample diversity across cultures and settings. Second, evaluating long-term impacts through longitudinal studies. Third, integrating scalable digital intervention models. Thank you for the time. That's all.
use the questionnaire?
Huh?
Did you use questionnaire? Question. Did you question? Survey. Did you do
Yes,
questionnaire?
yes.
Did you do?
Yes.
And after pre and post. Was it pre and post?
Post.
Post. You didn't do at pre. Okay. It was done at post. So did you mention that in your methodology?
This one?
The questionnaire part. Inclusion, exclusion, that part. Probably you can include it in the methodology.
Yeah.
Questionnaire. So it was missing. Because when you presented the data in your result, so we need to know what was your instrument, what was the scale you used. Isn't it?
I use the methodology.
Sorry?
Why we use this methodology? Or what?
No, questionnaire. So next time, maybe I'd like to suggest you that you can add in that part. What the research instrument that you use in the study, in the methodology. Alright, thank you. Alright, next we would like to, I would like to call again Mr. Howard Mohammed. Are you here, Mr. Howard? No? Okay, we proceed with the third presenter, Lee Feng. No? Alright, next Liu Yan Ru. Okay. So Ms. Lee Yan Ru will be presenting on the impact of non-pharmacological combined interventions on the elderly woman with hypertension.
We're interested in how blood-training and nutritional therapy could improve the blood pressure, stress levels, and the overall quality of life. Hypertension is a common and serious condition, particularly among the older women. While medication remains the standard treatment, it has drawbacks such as side effects and low adherence. Our study explores whether combining Pilates and dietary changes could be a reliable alternative. We can conducted a non-randomized controlled trial with two groups, one that continued routine blood pressure monitoring, and the other that followed structures the Pilates and the dietary program. The studies included women aged 60 to 75 years old, lasted 4 weeks, and measured key health indicators. The implementation group participated in Pilates training 3 times per week, focusing on stress, flexibility, and relaxation. They also followed a DASH-based diet with reduced sodium and increased nutrient intake. Our results were striking. The intervention group's blood pressure dropped significantly by an average of 2. Of 10 millimeters of mercury. They also experienced the lower symptoms, the lower stress levels, and the noticeable improvement in their quality of life. In contrast, the control group saw no significant changes. Those findings suggest that Pilates and the dietary interventions work together to improve overall health. This non-drug approach is practical and can be widely implemented. It offers a new perspective on hypertension management for older adults. In conclusion, the combined intervention significantly improved multiple health aspects in elderly women with hypertension. Future research should explore its long-term effects. This approach could serve as an effective holistic strategy for managing across conditions. And thank you for your time and listening, and I am happy to take any questions.
Thank you, Ms. Yu Yandru. Any question from the floor? All right. Yeah, you may ask.
Why did you choosing Pilates as a means of intervention instead of directly choosing yoga?
Okay, thank you. We know yoga is, especially Hatha yoga, is a part of Pilates. Why I choose Pilates but not yoga? We know yoga and even Ayurvedic therapy as a whole is adopted a very great choice, but Pilates is focused on the core muscle, and it will protect the elderly people, take them from the risks of fall down and other risks. So I want to take my attention on the whole life health and the safety and give their quality, a good quality of life. So I choose this. Thank you.
Thank you, Ms. Yu Andrew. Okay, can we proceed with the Mr. Liu Mi? Okay, so Ms. Liu Mi will be presenting on the development of infant self-recognition and its relationships with mother-infant attachment.
And its relationships with mother-infant attachment. Self-psychology emphasizes the caregiver's role in shaping an infant's sense of self. Early self-related abilities are critical for related ability are critical for psychological and social development. Attachment patterns significantly influence physiological and psychological outcomes. Existing research has largely explored these concepts separately, leaving their interrelationship less understood. And research objective investigate the developmental trajectory of infant self-recognition, example correlations between self-recognition and mother-infant attachment. Focus on infants aged 15 to 23 months and their mothers. Methodology, study design, observational and standardized assessments. Potentially experimental designs to explore causality. Participants, infants aged 15 to 23 months and their mothers. Data collection, use of observational methods and standardized tools. And as you can see, attachment types in psychological research and security 40% and disorganized 15%. Expected findings, enhanced understanding of the dynamics between self-recognition and attachment. Insights into the mutual influence of maternal behaviors and infant self-development. Theoretical foundation for early intervention strategies. Conclusion and significance. Integration of psychoanalytic and developmental psychology concepts. Practical guidance for early children interventions and parenting strategies. contribution to improving mother-infant attachment outcomes. And this is summary of key conclusions. Okay, thank you for attention.
Okay, thank you. So any question from the floor?
Thank you, Mai. How do you define and measure self-recognition in infants within the context of this study? Thank you.
Thank you for your question. Self-recognition is operationalized as the infant's ability to recognize themselves in a mirror, which is often considered a key milestone of self-awareness. So in this study, we employ standardized assessments such as the mirror mark test, where a mark is placed on the infant's face awareness without their awareness, and their response to seeing their reflection is observed. Behavior in the indicators such as touching or pointing to the mark are used as evidence of self-recognition. Okay, thank you.
Alright, thank you. So next, we'd like to call Ms. Suchitra Pal to present on lived experience of pre-dialysis chronic kidney disease patients, a qualitative study.
Good afternoon, everybody. Now I am going to present the life experience of pre-dialysis chronic kidney disease patients, a qualitative study. Why study life experience of chronic kidney disease patient? Because CKD is a global health issue, 5th largest contributor to global morbidity and mortality. Patient faces several challenges in managing the condition, especially in developing nations. In India, research has focused mainly on patients undergoing hemodialysis. Understanding the barriers of self-management in pre-dialysis patient is very critical. The present study addresses this gap by exploring the life experiences of CKD patients who have not yet got renal replacement therapy. Research objective is to explore the self-care deficit among CKD patients. Research question: what are the self-care deficits faced by pre-dialysis CKD patients in India? Now coming to the methodology, this study was conducted in the nephrology clinic of a tertiary care hospital with the patient having eGFR above 15 ml per minute per 1.73 meters square. A phenomenological approach adhered to correct checklist was utilized to take the 30 to 50 minutes in-depth face-to-face interview till data saturation occurred. Inclusion and exclusion criteria. We have included the patients having more than 15 ml per minute per 1.73 meters square eGFR and who were old above 18 years and were fluent in Bengali. We have excluded the patient who are above 70 years of age, had mental illness, were unwilling to participate, were critically ill or undergone hemodialysis or received renal transplant. Now the research tool was a semi-structured interview guide which was developed in English and translated to Bengali. Ethical consideration. Permission was obtained from the Ethical Commission of Central Hospital, Kolkata, India. Administrative permission was taken from the Institutional Ethics Committee, Lincoln University College, Malaysia, and informed consent for each participant was taken prior to the participation in the study. Now coming to the result. The participants were in the age range of 20 to 64 years with a mean of 53.46 years. The duration of illness varied from 6 to 84 months with a mean of 29.73 months. eGFR varied from 31 to 66 ml per minute per 1.73 meter square with a mean of 42.73 ml per minute per meter square. The study comprised of 3 female and 12 male patients. Themes of self-care deficit as deduced from the qualitative interviews. This is the research question. You can see what are the self-care deficit faced by the CKD patients, and from the interviews the main 4 themes were collected. The knowledge deficits regarding the disease and regarding the disease management, need for educational content, and third one is non-compliance, that is related to dietary restrictions, related to treatment and related to lifestyle modifications. And fourth theme was difficulties in coping, that one also related to restricted socialization and emotional and psychological struggles they have faced. So here are some codes of self-care deficit as deduced from patient interviews. One patient was telling, I do not know the cause as it occurred to me me as the first time in my family, that is related to knowledge deficit about disease. I don't know the details of treatment, that is related to knowledge deficit about disease management. I cannot eat chicken as I wish. Any other boy of my age is allowed to eat more chicken than me. I always feel hungry in between meals, but only 2 biscuits are allowed to me as snacks. Whether my medicine stock runs out, I discontinued them. And yes, I stopped taking blood pressure medicine as my blood pressure was normal. That is non-compliance to treatment. I stopped attending parties because of my weakness and lethargy. This is related to restricted socialization. This study could have some implication to the nursing, education, practice and research. In the nursing education, it may help in continuous professional development and promote understanding of psychological challenges, the challenges faced by the chronic kidney disease patient. About the nursing practice, it may help to develop the individualized care plans for the patients. And about the nursing research, it may help to explore the innovative self-management methods for the patients, and it may help in evaluating the effectiveness of self-management interventions for the patients of CKD. Now coming to the conclusion. This study highlights the experiences of pre-dialysis CKD patients, revealing significant gaps in their care, self-care, treatment adherence and coping strategies. To address those gaps, a comprehensive self-management program is essential to provide the adequate knowledge and skills necessary to manage their conditions effectively. Addressing those self-care deficits would not only improve their quality of life but also reduce the burden of the disease for the individuals as well as to the healthcare system. Further research should evaluate the impact of self-management program on the quality of life among CKD patients. Thank you all for your kind attention.
Thank you, Madam Suchitra. So, any question from the floor? Yes.
Hello, my name is Christina and I came from Indonesia. Your research is very interesting, especially for the quote for the self-care. And I guess we have the same interesting idea about the CKD. So I would like to ask you, have you included any self-management program in your study? That's it. Thank you.
Yeah, self-management program, you can see in this. For the main themes, the knowledge deficits, need for educational content, non-compliance and difficulties in coping, I have developed a self-management program after this study, which will be utilized in my the second part of my research program, that is the self-management module for the chronic kidney disease patient. Depending upon the themes extracted from the interviews, I have developed one self-management program that is not under this qualitative part, that will be implemented in the second phase of my study. Thank you.
Yes, thank you.
Any more questions?
Okay, thank you. My name is Zara from Indonesia. I know your study, you include your EGFR, right? Okay. Why you have included the EGFR more than 50 milliliter per minute for your study? Okay. In inclusion criteria. Thank you.
Yes, we have included the patient having EGFR above 15 ml per minute per centimeter square, as they are in the early stage of CKD, and our intention to slow the progression of disease so that the burden of the disease and effect of the disease will be lessened in the future days. And who are below 15 years of age, they have progressed almost to the end stage renal disease, and their views, their needs are quite different than those people. So we have not included those patients below 15 ml per minute per meter square, as those are already gone to the end stage renal disease. So their treatment and their all the things are quite different. That's why we have already, you can see in my topic that pre-dialysis CKD patient. So up to 15 we can catch the patient of pre-dialysis patient. After that, either they have gone to hemodialysis or peritoneal dialysis or maybe for renal replacement treatment. That's why, that's the reason. Thank you.
Madam, I have a query. Just you have taken 3 female and 12 male patients.
Yes.
Why this is very different? Is there any reason behind it?
No, I have done that till the data saturation, and when I have completed the 15 interviews, I have reached the data saturation. So after that, I have not included any participant. So when I have came through that, this is by what I can tell automatically. It is done automatically. No choice of it is.
I want to know just only 3 female
Yeah.
and 12 male. What is this type of difference? Why not 12 female?
It is a by chance, sir. Nothing by
chance?
Yes, by chance.
So, ma'am, any specific reason for you not to choose the patients above 70 years of age?
Yeah, as the age progresses, the EGFR automatically decreases. So we have to limit, and literature supports that after the age of 70, it already reduced. So we have stopped after after reaching the 70s. That is the exclusion criteria, ma'am.
Thank you. Thank you so much.
Thank you.
Next, we would like to welcome Mr. Rahimi Fikriya. Miss Rahimi Fikriya. So, to present on the factors that influence the occurrence of symptoms of Rett syndrome.